og tibuok kalibutan. Malipayon ko nga mutaho ninyo karong hapon doon natay espesyal nga bisita atong pinangga dinhi sa Subo incumbent nga senador sa Republika sa Pilipinas. Welcome to Cebu. Maayong hapon, maayong kilom-kilom, Senator Risa Hontiveros.
Salamat kaayo, Sir Leo, og maayong hapon pod. Ano yung isang expression? Maayong kilom-kilom?
Kilom-kilom, takip siling sa Tagalog.
Ang ganda naman. Wow, salamat kaayo. I have learned a beautiful new word for my Cebuano vocabulary.
Bakit andito ka sa Cebu this weekend, Senador Risa?
Several reasons, Sir Leo, na captured nung aking motto these years na healthy buhay o gahanap buhay. So, syempre, courtesy calls pa rin sa mga local government officials, other VIPs, o mga town hall meetings with various sectors. Lalo na yung labi na yung mga batakang sektor. Pati meeting sa Zonta Club ng Cebu 2, meeting sa mga electric cooperatives, ug sa business sector pod. And then yung AICS, no, yung Assistance to Individuals in Crisis Situations sa Cebu, supervised by my office. Yung kasama doon yung educational assistance for college level youth. Actually, Sir Leo, matagal na kaming nagfa-facilitate ng AICS para bigyan ng tabang yung mga Pilipinong apektado ng iba't ibang krisis na nga at mga kinahanglan ng tulong, medikal, pang-eskwela nga, pamasahe din, pagbangon mula sa sako na maging sa pagpapalibing. And of course, last but not the least, yung pagpapadayon pa rin ng Healthy Pinas Mobile Clinic namin. At nanggaling na iyon dire, no, earlier this year. So, karon nasa Subang Dako, sa Mandawi City naman. Sa Cebu, actually, Sir Leo, yung mobile clinic umabot na sa Barangay Pusok, Barangay Paho, Barangay Sabang sa Olango Island, ug Barangay Talima sa Island pod. And then all in Lapu-Lapu City, ug pati sa NOAA Vaccine Center sa Cebu City. Inaasahan din naming makapag-launch yung programang ito sa Bogo City, sa Medellin, saka sa San Remigio. Tatlong na kasi iyan na Sir Leo, tatlong Healthy Pinas Mobile Clinic na nakagawa ng 65 trips nationwide last month of October lang. Libreng medical services ito, mga ultrasound, ECG, X-ray, pati mga lipid profile and other blood tests, tsaka konsultasyon, no? Konsultasyon sa doktor doon. Higit 300 katao kada araw sa tatlong vans servicing Luzon, Visayas, o Mindanao simultaneously. And basically, ang main vision lang naman ito ay parang bayanihan on wheels. So those are the various reasons na adiri ako karon sa Cebu.
Senador Risa, isa ka sa pinaka-active, pinaka-visible, pinaka-sensible na member sa Congress. Ano po ba ang highlights sa accomplishments mo sa past 6 years na ma-report mo ngayon sa Cebu at neighboring areas?
Well, I hope na truthfully mapapaniwala ang mga kauban diri sa Cebu o sa neighboring areas na I have tried to work especially on health laws para sa kababaihan, kabataan, mga pamilyang Pilipino, o persons of various genders in the past years. Ug lalo na in the last siguro more than 1.5 years, Sir Leo, on policies, legislative inquiries, and budget interventions na magiging COVID responsive, no? Pandemic responsive o recession responsive. Kaya we're all really hoping and praying and working towards yung totoong new and better normal.
Tungkol sa COVID, Senator Hontiveros, what did we do right and what could be improved on as we are seeing a downtrend of cases na hopefully masustain na?
Ohon, my God. Unfortunately, up to this point in time, we could probably say more what we could have done better than what we have done right so far. Pero okay lang, no? Basta matuto tayo sa ating mga leksyon. Going back to halos the very beginning, we should have closed our borders, no? Immediately to China and some other countries na we were already picking up information na dito nanggagaling yung mga nationals nila na may sakit na pala at nakapagdala dito sa ating bansa. Kay dili natin isinara kaagad yung ating mga borders, at least temporarily. Karon, we should learn the lesson that we need to still scale up. Sabi ko nga, step up, no? Yung iba't ibang interventions natin laban sa COVID, which are testing, contact tracing, isolation or quarantine o treatment, and syempre karon the fifth life-saving step, yung vaccination. I say step up kasi literally standardized contact tracing, tapos targeted and periodic testing, expanded and timely ayuda, protect health workers and their families. Tapos sa upscale and upgrade health facilities o push for the completion of the national vaccination program. Yung isa pang we could and should still do better karon is to really give full support sa ating mga healthcare workers in terms of yung special risk allotment, hazard pay, really humane and more COVID-free working conditions. And then when you look from the pandemic to yung kambal niya, yung recession, no? Ang dami pa ring social protections na dapat maibigay natin sa working people in different sectors, lalo na yung mga mahihirap na pamilya o yung ating mga MSMEs, so that they can survive and really be a major part of that new and better normal.
Senator Hontiveros, I would like to remind you the last time we talked, when ABS-CBN was still on air dito
The
sa mga
good old
probinsya,
days. Pohon bumalik.
board member ka pa sa PhilHealth. I
Lagi.
could remember, and
Lagi.
we had lots of discussions about dun sa mga programa ninyo sa PhilHealth. Sadly, after your departure, parang bumagsak uli yung PhilHealth. Napaka-raming problema ng PhilHealth. How do you propose to fix those problems sa PhilHealth?
I propose, Sir Leo, una na may national consensus dapat na kailangang ayusin ang mga problema ng PhilHealth. Kailangan mag-survive o mag-improve ang PhilHealth, further reforms, kay ang health financing o insurance remains one of the 6 pillars of a universal healthcare system na tinatayo pa rin natin ngayon sa Pilipinas on the strength of the UHC law. And kahit sa template ng World Health Organization, yung health financing or insurance, which here in the Philippines is PhilHealth, yun ang pang-salba sa mga pamilya from financial ruin kapag mayroong lalo na catastrophic illness like COVID can be, ay tumama sa isang family member. So protect from bankruptcy, pero ensure na may access pa rin sa quality healthcare yung bawat miyembro ng PhilHealth. So in the wake of yung mga nauna ng reforms sa PhilHealth, including yung pag-extend ng subsidized membership from indigents to senior citizens, hangtod karon sa mga persons with disabilities, kinahanglan na yung PhilHealth ay siguruhin na mayroong actuarial life which will inspire confidence in the public. And iba naman siya, hindi siya pension system eh. Parang pay as you go siya. And in fact, dapat nga nape-pay out yung pera niya sa mga miyembro precisely to cushion their family economics whenever any one of them gets sick. Tapos, ang napaka-importanting ipagpatuloy sa PhilHealth, lalo na karon in this pandemic when bukod sa COVID-19, we Filipinos are still dealing with many other health concerns. Palakasin na once and for all yung outpatient benefit packages. Kaya for the longest time, we could enjoy the PhilHealth coverage kapag confined tayo. Pero ang totoo ay the greatest out-of-pocket expenses of Filipinos hangtod karon are check-ups with doctors, lab exams, at saka mga gamot. So, the outpatient benefit package, the check-up package of PhilHealth really has to be strengthened. And I guess last but not the least, kay sa Senate, we did a very comprehensive committee of the whole investigation sa lumabas na PhilHealth graft and corruption during this current administration. So, in fairness kay PhilHealth President CEO Geran, sinasabi ng mga observers na mukha namang dahan-dahan ini-implement nila yung aming mga rekomendasyon sa committee report noon. Sana magpatuloy iyon, no? Para to set PhilHealth irrevocably on an even more professional, a more reformed, and a more responsive path.
Paano mabalanse ng PhilHealth, Senator Hontiveros, yung pangangailangan to guard against fraudulent claims, at the same time, hindi malulugi yung mga ospital na masyadong delayed yung reimbursements nila?
Yun yung very difficult situation karon and very valid issue put forward, lalo na ng mga private hospitals. Kay dagan sa kanila are saying na lumalampas na daw sa turnaround time of 60 days maximum ang PhilHealth bago sila i-reimburse. So naapektuhan nga daw, dili nga lang daw yung operational expenses nila, pero pati daw yung pagbayad nila ng benefits sa kanilang healthcare workers. Pero nung umabot sa punto na nag-threaten o nag-warn ang private hospitals na mag-disassociate sa PhilHealth, kaya nanawagan na po sa PhilHealth at sa private hospitals, please no. PhilHealth, talagang sa mga valid claims naman, bilisan yung turnaround time. Pero private hospitals, please, wag namang mag-disengage sa PhilHealth kasi nga, those are two pillars of a universal healthcare system. Yung health financing or insurance at saka yung service delivery network na at the top level precisely are the hospitals, including the private hospitals.
Senator Hontiveros, kumusta ang Universal Healthcare Law implementation?
Ay, 'di ba nung naipasa natin yung UHC law several years ago, sobrang para sa akin historic moment 'yon. Kay finally we became one of those countries na may commitment in law na magtayo ng UHC system with the general template of the WHO, pero committed na maghanap ng modelo na bagay sa Pilipinas at gagamot din dun sa unintended fragmentation ng health system natin gawa ng implementation ng local government code. And actually, Sir Leon, nung tumama yung pandemic, my first thought then was really, oh, itong pandemic, as terrible as it might be, ito yung litmus test para sa implementation ng UHC law. Kay, nandun na sa UHC law lahat nung mechanisms natin to respond effectively even to an extreme situation like a pandemic. Kaya bukod sa the terrible toll on the Filipino people ng pandemic in terms of sickness, in terms of death, in terms of yung pag-expose sa current weaknesses ng healthcare system at pag-exacerbate nun, ang isang nakakalungkot pa ay parang we have been missing the opportunities to precisely use the UHC law to respond effectively sa pandemic o para itaguyod nga yung UHC system dito sa atin. But in any case, di ba, sinasabi nating mga Pilipino, habang may buhay, may pag-asa, wala tayong excuses not to learn the lessons of the last almost 2 years of pandemic. Sabi ko nga kanila, let's step up and let's take this ball into our hands, run with it. Huwag nating sayangin yung UHC law Let's use it to save more Filipino lives at gamitin din natin yung UHC law para to set up that envisioned universal healthcare system in the new and better normal.
But the question, Senator Hontiveros, is
Mm.
parang misplaced ang priorities ng administrasyon. Even before the pandemic, they slashed 10 billion pesos from the DOH budget sa first year ng implementation ng Universal Healthcare Law.
Correct.
Now they're slashing budget sa UP system na kasali
Right.
ang Philippine General Hospital.
Mhm.
They're slashing the budget sa RITM na siya yung
Mhm.
guardian sa PCR testing at saka
Correct.
monitoring ng new diseases. Pero
Mhm.
napakalaki nung increase ng budget ng NTF-ELCAC, nung mga
Mhm.
intelligence funds.
Mhm.
You are deliberating on
We
the
are.
2022 budget. Anong findings niyo sa Senado? Paano ma, ma, maisauli yung mga slash budgets ng mga health concerns?
Well, thank God nga, Sir Leo, na mayroong kongreso o legislature dito sa ating system of government na pwede at dapat naming i-correct kapag may kulang or mali or misprioritized na budget in the General Appropriations Bill or in the National Expenditure Program na isasubmit ng executive sa amin. And tama ka, no? Even before the pandemic, may mga kontrapelong moves ang administrasyon which now that in hindsight didn't bode well pala para sa implementation ng UHC law. So even before itong very poor pandemic response in the last 1.5 years, may mga warning signs na pala na hindi magiging fully committed sa implementation ng Universal Healthcare Law. So in any case, andito na tayo sa sitwasyong ito, and indeed, yung kasalukuyang budget debates are the opportunity and in fact, the obligation for us sa Senado at saka sa buong Kongreso to try to set things a little more right. Halimbawa, last year, originally, ang health budget was only 5th priority. Nagawa naman naming batakin pataas to 3rd priority. Kaya medyo nakakashock. Ito taong natanggap namin yung NEP from the executive was at 4th priority. So parang ba tayo natututo? Nasa pandemic pa rin tayo. We brought the 2021 health budget up to 3rd priority. Bakit nagpo-propose to put it at 4th priority? We should bring it higher, not lower. So in principle, pagkatapos ng education budget na according to the Constitution, kailangan highest budgetary priority yan, shouldn't we in principle bring the health budget up to 2nd pa nga? At the very least, dapat bumaba sa 3rd, which is its priority this year. At pantay or kasunod ng health budget, yung ating economic recovery budget. Kasi nga, pandemic at recession yung dalawang mukha o yung kambal na pinaka nagbigay ng suffering sa ating mga Pilipino in the past 1.5 years. So, tingin ko, yun ang tungkulin namin sa Senado at sa buong Kongreso karon to put together a better 2022 budget than the one proposed by the executive. Isang budget na mas health responsive at saka mas economy responsive.
At saka, Senator Hontiveros, for the record, daghang salamat sa imong kaisog o sa imong kakugi sa Pharmally investigation.
Salamat po.
Salamat sa imong pagkuha adtong whistleblower, nakahibaw ta sa substandard o mga binuang sa Pharmally sa mga muralag parang nilaruan lang nila yung 8 billion ba yon? 12 billion peso transactions nila with PSDBM at saka DOH. Ano-ano ang mga legislative interventions or na pwedeng i-craft na mga laws to address the loopholes that the Senate Blue Ribbon Committee found out during your investigation?
Ay nako, salamat kaayo sa ganyang appreciation sa Blue Ribbon Committee hearing, Sir Leo. Kay we've said from the beginning, actually of any investigation, na in aid of legislation talaga ito. At gaya nung parang clue na binigay ni Blue Ribbon Chair Sen Dick, na sobrang jam-packed with findings yung magiging committee report namin at mabigat sa mga seryoso, malalakas na rekomendasyon. So much so that we have to draft a preliminary report para lang bigyan ng preliminary look ang public sa final committee report na aming ilalabas. Pero ngayon pa lang, mukha talagang pwede kaming mag-recommend ng filing of charges against Pharmally officials, against former PSDBM, OIC, DBM MUSEC Lao na pinaghahanap pa rin ng Senate Office of the Sergeant at Arms, against Mr. Michael Yang, and persons to be identified in the Department of Health who set this whole sorry story into action in the first place. Kasi sila nga yung unang pinansin ng COA di ba, sa kanilang audit report. The other leads that we still have to tie up loose ends about would be yung Suzhou Construction and Machinery Group, yung DOTR, Philippine National Railways, na binentahan din pala ng Pharmally ng overpriced pandemic supplies. And last but not the least, of course, although immune from suit siya habang nakaupo, but the person of the president himself. So, kung ganyan ang aming mga mairerekomenda, ang kakambal din nun would be proposed amendments to existing anti-graft and corruption laws, kaugnay pati sa palagay ko mas mahigpit na pag-regulate ng DBM sa PSDBM. And there are other proposals that go as far as abolishing that procurement service itself. Hindi ko alam kung aabot sa ganyang extreme. Tapos, yung pagpapalakas nung pagsunod sa ating Internal Revenue Code. Kasi paanong papayagan na ang mga kumpanya tulad ng Pharmally at tulad ng Suzhou ay hindi i-honor yung tax obligations sa Philippine government. So those are at least two of the major laws na pwedeng maging subject ng amendment ng susunod na Kongreso bunga nitong pambihirang investigation sa Pharmally.
Final question, Senator Hontiveros, and please allow us to be parochial.
Oh, sure.
What's in store for Cebu sa legislative agenda mo sa next term?
Oh, nako. Salamat kaayo, Sir Leo. Cebu will always be among the top of mind for me sa aking legislative agenda. Kay, from the start, na sumubok ako para sa Senado after serving as Akbayan Party representative in the House of Representatives, where Cebu also played a large part. Hangtod karon, every time I ran later for the Senate, Cebu really supported me. So karon, the past half decade, I've been able to work in the Senate. I've always been in touch with advocates, both in government and the private sector, plus, third pala, civil society, diri sa Cebu, working on my different legislative or laws passed so far, yung pinag-usapan natin sa simula. So moving forward, I look forward, Sir Leo, to continue to coordinate with the different Cebu stakeholders, lalo na sa paano ba yung new and better normal para sa Pilipinas. Karon pa lang Cebu is already setting up best practices, models na pwedeng tignan. Halimbawa, this morning I learned sa Mandawi City, umabot na sila sa 70% vaccination coverage. Yun ay national target. Hindi pa naabot ng national. 70% din lang sa NCR, but 30% on average in all the regions outside. But from within Cebu province, there is a city here na umabot na dyan sa requirement for herd immunity. So I believe I will continue learning from Cebuanos yung elements ng a new and better normal in terms of health. And then in terms of the economy, among various sectors, yung isang talagang lumitaw during the pandemic ay yung mga freelancers working on social media apps and platforms tulad ng ating delivery riders. So yung gig economy, talagang nag-boom nitong pandemic. And Cebu, she has always been isang sentro ng mga new economic models and hindi naglalag behind yung pag-assert ng Cebu na paano natin ipoprovide yung social protection for these new emerging sectors of the working people. So, dun sa mga economic policies for a new and better economic normal, patuloy din akong kailangan magkonsulta dito sa Cebu to push a better politics and a better governance forward from within the Congress. Pohon, if I get to work within the Senate again.
Senador Hontiveros, good luck sa imong kampanya
Salamat kaayo.
amid the pandemic. Imong mensahe ma'am para sa nagtan-aw nato karon from Cebu, Bohol, Negros Oriental, Siquijor, Leyte, Southern Leyte, and the Samar provinces.
Daghang salamat kaayo kaninyong tanan. Damo nga salamat sa tanan na nakinig kasama namin ni Sir Leo dito sa conversation. Karong hapon, karong kilumkilom, the beautiful new
Kilumkilom.
word I have learned. Sana pohon moving forward into what we all want to design as a new and better normal. I-claim natin bilang mga Pilipino yung healthy buhay o healthy hanap buhay. These are common sense requirements para makasurvive o maka-flourish tayo post-pandemic o post-recession. Pagtulong-tulungan natin sa isang bago at re-energized sana na bayanihan after this very tumultuous half-decade so far. Pero kaya natin yan. Magtulong-tulungan lang talaga tayong lahat ng mga Pilipino. Amping, and hope we have a happier Christmas.
Senador Risa Hontiveros, daghang salamat sa imong pakig-uban namo karong hapon. Ug sa tanan nato mga viewers, daghang salamat sa inyong pag-apil sa Panahom sa Kilumkilom. Thank you, ma'am. Good luck.
Thank you so much. I need it. Thank you. And thank you for that beautiful word. Amping, Sir Leo, ha?
Sige, ma'am. Salamat.
Okay.